You know, I don't know about all of you, but I find it so hard to believe that we're standing here before you today still grappling with the exact same challenges we've been facing for the last 2 years. Every day, I hear from residents who are fed up with one-party control in New York, and it's not just talk. With hundreds of thousands of New Yorkers fleeing just last year, it's clear that our neighbors are tired of government overreach, scared by the increase in violent crime, infuriated with rising costs, and frustrated that they pay the highest taxes in the nation and see so little for their return. And I know all of my colleagues, we get hundreds of emails every day, but one in particular just stuck with me, a young couple that are both working full-time, and they said, you know what, with the rising cost, we have to choose between paying for food and paying for heating and electric. I can't even imagine what our seniors are doing right now. It's time for lawmakers to wake up and hit the ground running this session to get our state back on track. That starts by ensuring that New Yorkers have the freedom and the resources that they need to thrive. It also starts by addressing the needs of those who have been especially impacted by the COVID-19 pandemic. This session, and I'm sure you're all familiar with these subjects that I'm going to talk about, we've heard from people, we need to redouble our efforts to combat the opioid resurgence with increased investments in prevention, treatment, and recovery services. And we absolutely need to bolster our mental health services for New Yorkers of all ages, but especially for our young people whose lives have been so upended by the COVID-19 pandemic. You know, we were lacking before, and now it's just so much more amplified. We need to double the funding for the Joseph P. Dwyer Veterans Peer Support Program and bolster services that ensure that our veterans and their families have access to the resources that they absolutely deserve. We also need to increase support for aging New Yorkers by ensuring elder care communities, nursing homes, and home care services have the resources they need to provide high-quality care. You know, for the past couple weeks, I've been taking care of both my mom and my mother-in-law, who have been grappling with some health care issues, and I know, as many New Yorkers know, it seems like another full-time job. We try to coordinate care, getting them to their appointments, making sure that their homes are accessible and safe. The to-do list just grows and grows every day for New York's countless caregivers. New Yorkers need elder care systems to be simplified. And boy, do I know that more than ever now, having experienced this firsthand. We need to ensure that family caregivers have the support they need, and we need to drastically expand home care to ensure that New Yorkers can age in place in the communities that they know and love, where they feel safe and secure. Today, we must commit to putting politics aside and to advance the common sense agenda if we want to stop the outmigration, get our state back on track, and really move forward from the pains of the pandemic. Thank you so much.